There are several really early signs. When your child's starting to develop, and I'd say especially in that second year of life, and if they don't respond to their name, they have very poor eye contact, they don't engage in the game peekaboo, if you smile at them, they don't smile back, if they seem to have very limited interest in other children and adults, if they do any repetitive behaviors like rocking, literally running in circles, those are a few of the real telltale signs that your child has to get some early intervention, because they probably are on what we call the spectrum. A lot of them will have few or no words by the age of 2, and they will also have some odd behaviors, flailing of their arms. A big one is walking on their tiptoes, which, not that we fully understand it, but they walk on their tiptoes. And they also are very unable to handle change in their routine. When you go from one activity to another, they get very disrupted.
Remember, having one of these issues doesn't mean you have any of them.
Correct.
It's a spectrum.
Right.
So it means you have many kids walk. If they're walkers, will learn to walk on their toes.
Right.
Many kids may not make good eye contact, but they do some other things. There's also a situation where kids don't develop good socialization, need a little extra help, but they do everything else okay.
Right.
Okay. There's even a condition which I have in the practice where kids that just pick who they want to speak to. The selective mutism. They might speak to the mother and not anybody else. Mm-hmm. These aren't what we're talking about. We're talking the gamut of things. You see most of this, not all of it, most of it, red flags.
Absolutely. It is the whole, you have to see many of these signs. Yes, one or two I would not be concerned about. I might mention it to the pediatrician, but I wouldn't be particularly concerned. They also tend to have super sensitivity to temperature, sound, light, and they will have, some of them, severe temper tantrums or severe episodes of fearfulness for no apparent reason.
Even when you eat food, certain types of textures bother the kids sometimes.
Yes.
You'll notice that.
Yeah.
And in retrospect, when you talk to parents, yeah, you're right. So remember, it's a spectrum. It's not one, it's many.
Yes.
May not be all, but many of it. Is that correct?
Absolutely. But like I say, if anybody out there listening has a child who's showing 1, 2, or even 3 or 4 of these things, clearly they should get some information related to the pediatrician and look into early intervention programs.